Well, hello everybody, and welcome to Neuroscience. So let's just start by saying that neuroscience is the coolest stuff. Oh my God, it's so amazing. Just studying the brain. It's amazing what it does, and we're going to spend a semester looking at all the cool things and trying to understand it as much as we can. So why do we study the brain? Why are you here? Why'd you sign up? Uh, well, the brain may be the most complex living structure in the world, but again, it's our brains telling us that. So there's a little bit of that. But there are, I don't know, 80 billion neurons and trillions of neuroglia in there. And each of these communicate with an average of 10,000 others each. And so there's trillions of synaptic connections just in your brain. There's more synaptic connections in the brain than there are stars in the galaxy. And your brain isn't static. It grows, it repairs, it adapts, it is constantly changing. When you learn something new, you make new neural connections. You literally rewire your brain as you learn. And what the brain does is it controls to a large degree who you are and how you act and why you act the way you do and why you react. So it controls all parts of the body. And when things go wrong with the brain, more Americans are hospitalized with neurological, like stroke, for instance, and mental disorders, bipolar, unipolar depression, than when any other type of major disease group. So, and then if you throw in addiction, well, it's even more. And a lot of it, addiction lives in the brain. Let's be honest. There's obviously environmental and social factors that influence it, but the influence areas in the brain. Now, just some kind of philosophical questions for you. I don't expect answers, but it'd be cool to sit around and think about what the answers might be. So, what does the brain do? Brain does many things. It senses, smell and taste and sight and hearing and other senses other than the top five we talk about, and it reacts based on what sensory information is coming in. It helps coordinate the function of many organs. So it sends signals down to control heart rate, to affect heart rate, and affect respiration and digestion and hormone release. It stores and organizes and then retrieves past experiences. We don't quite understand memory, and it's false that every single thing you've ever experienced is stored in the brain. That's just not true. But we're still learning about memory. Now, other things the brain does, it's so sensation and movement, helps regulate the internal environment, helps regulate when you're ready for reproduction. It sends different hormones. It's for learning, it's adaptation. There's so many things that the brain organizes and controls. So that's the brain. What is the mind? So that's a really tricky thing. And that's a question for philosophers as well as neuroscientists. But does the mind exist separate from the brain? So I'm just curious about what your answer is. Does that mean if they're the same thing, is the mind the brain? Is the brain the mind? Uh, what about gut reactions? Is that something that actually exists in the brain and we just call it, in the gut, or and we just call it the brain? What's going on? There actually are a ton of neurons in the gut, and they affect our mind. Gut bacteria has a strong effect on emotions and depression and Alzheimer's and all sorts of things. So does the mind live in the brain, or is it a full body thing? And leads to other questions of what is consciousness. Um, Descartes said, "I think, therefore I am." And so consciousness was existence. Is that true? Well, who is conscious? Are animals conscious? I think so. Is a fetus conscious? At what point does a fetus become conscious? Does there have to be a certain number of neurons? Does there have to be a certain number of interaction with the outside world? What does it mean to be brain dead? And we don't have the answer, but we can start to think about some of these really juicy, good philosophical questions. Now, how aware of our minds are we? Personally, if I think too much about what I'm doing, sometimes I screw it up. Some things you just have to let go and let your mind just do its thing. And when I used to play tennis, and if I play doubles, I have to be front, because if I was in back, I had too much time to think about it and I'd screw it up. But if you're right there in front, your body just responds. So if you start to think about typing, do your fingers get all screwed up? So is there some point that if we're too aware of it, we lose the autopilot and we lose control? Don't know, but just some good juicy questions to think about: mind, body, and brain. Now, with neuroscience today, there's a lot of different ways you can be a neuroscientist, a lot of different levels of analysis. So molecular neuroscience, that's the most elementary level, let's say. And as a molecular neuroscientist, you may study, neurotransmitters or growth factors, channels or gates. Cellular neuroscience, okay, how do these molecules work together? How many different types of neurons are there? How do the neurons influence other neurons, or how do they form during development? And what about neuroglia? So let's look at the neurons or the neuroglia themselves and analyze them. So that's getting a little more broad, getting even more broad. We're going from tiniest to biggest. Systems neuroscience. Let's look at circuits that perform a common function. So let's look at the visual system or the motor system. Then behavioral neuroscience, we're getting still even more broad. How do these systems work together to produce integrated behaviors? So what is memory? What are the different systems involved? What are the hippocampal loops, and what is it? Where are things stored? Male-female behaviors. What parts of the brain influence? I'm making air quotes when I say male-female behaviors. Are there stereotypical male behaviors? Or now we're getting into gender, and that's a man-woman thing. It's just, my kitty is chiming in. Is that a societal thing rather than a brain thing? So sleep, though. Sleep is a behavior that we might look at, or drug addiction might be a behavior. And then we get into cognitive neuroscience, and that's getting real big. That's understanding the mechanisms that are responsible for higher levels of human mental activity, like self-awareness or language or mental imagery. I'll tell you, I live here. So here we get much more genetics and molecular, and here we're moving into psychology, and here we're kind of moving into philosophy. My happy place was always pretty much here. I studied sleep, I studied drugs, I studied sex, drugs, and sleeping. I'm starting to study eating behavior too. So all the deadly sins, that's what I study. So that's going to be more behavioral, but you can find a place in neuroscience at a lot of different levels. And there are a lot of different types of neuroscientists. So a neurologist. Neurologist is going to be an MD that diagnoses and treats diseases of the nervous system. They have, you go to a neurologist and they'll have you squeeze things and look at this and have different tests. But a neurosurgeon, they're going to be the MD that performs the surgery on the brain and the spinal cord. And there's not that many. It's a very long, I'm blanking on the word, internship, and I'm blanking on the word that comes after internship. Oh, well, I'll think of it later. But so you go to med school, then you're an intern, and then you're long residency. That's it. There's only about 4,500 neurosurgeons in the United States, which is one for every 66,000 people. Okay. On the African continent, there's only there's only one neurosurgeon for every 1.4 million people. And if you take out Northern Africa and South Africa, there's only one neurosurgeon for every 6 million people. So there's a great need for neurosurgeons. Let's see. Psychiatrist is also an MD, and that's going to be a doctor that diagnoses and treats mood disorders or personality disorders. If you go to a therapist, they can't diagnose, they can't, I can't think of the word. My goodness. Prescribe. Thank you. They can't prescribe meds. A psychiatrist has to do that. A neuropathologist, that's an MD or a PhD, and they recognize the changes in nervous tissue that can result from diseases. A molecular neurobiologist, they look at the genetic material of neurons, and they want to understand the structure and the function of all the neurons in the brain. the molecules of the brain. What else we have? We have neuroanatomists. They study the structure of the nervous system. A neurochemist, they look at the chemistry. They're going to look more at the neurotransmitters. Neuroethologist, they look at the neural basics of species-specific animal behaviors in a more natural setting. Neuropharmacology, that's what I got my degree in. They are going to look at the effects of drugs on the nervous system. A neurophysiologist, they're going to look at the electrical activity in the nervous system. They're going to look at action potentials. Neuropsychologist, they are going to study the neural basis of human behavior. And finally, a physiological psychologist, they study the biological basis of more animal behavior. So a lot of different ways you can go into neuroscience. And there's more than this, actually. There's people who study neurosexism and the way that our views on gender influence our analysis of brain function and structure. So there you could be philosophy and look at how our understanding of the brain influences our understanding of philosophy. So there's a lot of different ways to be a neuroscientist. But now let's get into the question of how would you learn about the brain? So if you want to learn about the brain, what would you do? What would you do to learn about the brain? And one of the oldest ways is called brain ablation techniques. Basically, you go in there and physically destroy an area. So, they, like thousands and thousands of years ago, they noticed that, okay, this person had a hole in their skull and they had some different changes in their behavior. But what some methods of this is physically destroying the area. There are precise and imprecise methods. One imprecise method was a lobotomy. Walter Freeman, he was a doctor that pioneered the operation, the frontal lobotomy, and he made a name for himself doing them. And they did these for decades. And what I'm going to do now is I'm going to show a video. I'm going to show the 5-minute one, and it's about Walter Freeman. And okay, let me just click on that. So here I'm going to show you this now, because when I post these on YouTube, they don't always allow me to. Sometimes they make me take the video out if there's a copyright infringement. So I'm having this home screen on, so you can just Google this if they make me take it out. But let's just show this one.
He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but it's how science can go off the rails.
Ellen Ionesco was the first patient to undergo a procedure Dr. Freeman had perfected only weeks before. He called it transorbital lobotomy.
In a transorbital lobotomy, Freeman would first have the patient rendered unconscious through the use of the electroconvulsive shock machine.
Just before he threw the switch, we all had a laying on of hands and went for a little ride.
Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
The patient would then enter unconsciousness for a relatively brief period, but several minutes.
Now that the convulsion has subsided, the nurse holds a towel over the nose and mouth of the patient.
Freeman would peel back each eyelid, insert his ice pick, and with a hammer, tap through the brain, wiggle it about, sever the frontal lobes, withdraw it. And when the patient came to, he or she would be given dark glasses to hide the black eyes they've been given.
We didn't have a refrigerator, we had an ice box. The first ice picks came right out of our kitchen drawer, and they worked like a charm.
Turning now to the operation itself, very little preparation is necessary for transorbital lobotomy.
The instrument was put in above the eyeball and in the plane of the nose. You could feel it hit the roof of the orbit, and then with a tap of a hammer, you could knock it through. The whole thing would take 3 or 4 minutes.
This patient came to the hospital this morning after breakfast, and he will leave tomorrow afternoon.
There are reports which he proudly writes down in his diary about fellow professionals fainting as he proceeds in this, or vomiting.
Dr. Watts didn't say anything. He simply turned around and walked out. Spurred on by Freeman, the number of lobotomies performed annually soared from 150 in 1945 to over 5,000 in 1949. Despite the known side effects, there seemed to be an endless supply of willing patients. Ultimately, the fate of lobotomy would be settled by a pill. In 1954, a new drug called Thorazine began to sweep through state mental hospitals.
Thorazine was initially marketed as a chemical lobotomy. I mean, this was seen as a selling point that it produced results similar to lobotomy, but without, of course, all the risks of the surgery.
Freeman decided to move to Los Altos, California, to resurrect his career. Far from the reproachful Eastern medical establishment, he could try to bring lobotomy to new categories of patients.
If housewives found their early 1950s existence too depressing for words, why, Freeman had a solution that would get them through their day happy as little clams. If children were misbehaving, conditions we might now see being called hyperactivity disorder, why they might need a lobotomy.
In all, Freeman lobotomized 19 children under the age of 18, including a 4-year-old. By 1967, Dr. Freeman had personally performed more than 2,900 lobotomies. In February, at Herrick Memorial Hospital in Berkeley, he performed his last when a patient died of a brain hemorrhage. Freeman was stripped of his hospital privileges and soon retired from his medical practice.
Oh, shoot. So lobotomies were a thing. They put that ice pick in and just very imprecise, just went swish, 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 swish to separate the frontal lobe from the rest of the brain. And they retained cognitive function, but this is very imprecise, and it did some terrible things to many people. And I always wonder, what are we doing now that in 50 years we're going to look back on and say, oh my God, can you believe they did that? So just some people who had it done. This is Rosemary Kennedy. It was President Kennedy's 23-year-old sister. She had some learning disabilities, and in the Kennedy family, you had to be perfect. And so in 1941, they gave her a lobotomy, and she was institutionalized for the rest of her life and spent the next 56 years in the institution. This is Howard Dully. He was 12 years old, and he was lobotomized at 12 after his stepmother complained that he was difficult. And here's from the doctor's notes about Howard Dully. He objects to going to bed, but then he sleeps well. He does a good deal of daydreaming, and when asked about it, he says, I don't know. He turns the room's lights on when there's broad daylight outside, and got lobotomized for that. And he wrote a book called My Lobotomy. So it's very sad, and it just does make me wonder, what are we doing today that we will be horrified at? So that is an imprecise way of physically destroying the area of a brain. But we do precise surgery as well. So this is stereotaxic surgery. I did this on rats. Many people who studied neuroscience did this on rats. And rat skulls have these lines on the brain, and it's all mapped out. So if you go a few millimeters in one direction or another, and you drill down, so then you just like drill down into their brain, what with some precision what you're affecting. And I did that, and then I couldn't do animal research anymore. I believe in it, but found it. Rats are sweet. It was hard to do. So then you can know that we're affecting, for instance, the basal ganglia. So you can do that physically, or you can chemically destroy an area. So you can give a drug that you know that will be taken up into dopamine neurons, for instance, and then destroy those neurons. What else? Now, if you do this in animals and you physically destroy an area and then you want to see what the function is destroyed, but it's hard to interpret. So if you teach a frog to jump when it hears a sound, and then you lesion their temporal lobes and they don't jump anymore, it would be easy to say that the temporal lobes control jumping. Oh, we lesion the temporal lobes, they don't jump anymore, but they don't hear is what's going on. So you have to be careful when you interpret these results. Causation and correlation are not the same thing. Just a few more. I know this is a long one, but just a few more. Now, one other way to figure out what's going on in the brain is you can look at people with dysfunction. Broca was a French neurologist back in the 19th century, and he met a patient who could understand language but could not speak. And after the patient died, Broca examined his brain and found a lesion in the left frontal lobe, in that area that later became known as Broca's area. And one of the things it does is it controls the movements you make in order to speak. You can understand language, but it helps the physical activity, the dance of your tongue and your lips in order to speak. And that's Broca's area. Let's see, Phineas Gage we'll talk about in another section, but you may have heard of this case. A big iron rod went through his brain and his behavior changed afterwards. So we learned some things about the brain with Phineas Gage. And then the last one I'll close it out with is Mary Rafferty. Mary Rafferty was a servant in 1874, and at the time they used the phrase feeble-minded because she had a childhood injury. She also had a lesion on her scalp, a cancerous lesion on her scalp, and she had the lesion for just over a year, and it actually was so bad it eroded through her skull so that you could see her brain, specifically into her parietal lobe. So there's this doctor who said, "Oh, cool, brains. Let's see what I could do with that. She's a servant. You know, she's feeble-minded. She has no autonomy or no rights. Let's just go into her brain." And so he stuck electrodes onto her brain and applied an electrical current to different locations. And we learned some stuff. So experiment 1, he put these electrodes on and turned on the current, and he found that the dura, the connective tissue surrounding the brain, wasn't sensitive, and the brain itself has no pain receptors. Experiment 2, zapped and find contralateral movements. So if he stimulated the right side of the brain, it caused movement on the left side of the brain. If you stimulate, for instance, the motor area on the right, it causes movement on the left side of the body. Experiment 3 looked at what we call the postcentral gyrus. That is the somatosensory, that's sensation. And it got some degree of the somatotopic organization of the brain. If you stimulate this is where you feel it in the hand. Here's where you feel it in the leg. But she started to have seizures. He was using a strong enough current to start a car. He was using a really strong electrical current, and Mary Rafferty started to have seizures. So experiment 4, he lowered the voltage and tried again, but she kept having seizures. And the seizures made her incoherent, so she could no longer say, "Oh, I feel this." And eventually it killed her. And so experiment 7 was the autopsy. Now, we learned some things. It stimulated knowledge, but great ethical debate. I mean, can you give consent if you're not cognitively there, or if you're a servant? There's some social and class situations going on as well. And what's the difference between experimentation and therapy? So really, it opened up a discussion of what is ethical to do on a patient. And we still have those discussions today. All right, so I'm going to close this one out. Well, actually, while I'm talking about ethics, how do you feel about animal research? Are we ethically, is that okay to do research on animals? What do we get from that versus what do we lose from that? And animals don't have autonomy, but is it better testing a drug or something on an animal than on a human? What do we do? So start to think about some of these things, because there's a lot of ethical debates that you'll have to come to terms with how you feel about it to determine where you go in your career. So I'm going to close this one out, and then in the next video we'll talk about technology we have to look at the structure of the brain. All right.